I want to thank you for joining us as we provide an update on our provincial planning and preparation in the event of a suspected case of Ebola in Newfoundland and Labrador. I'm pleased to be joined by Dr. Faith Stratton, our Chief Medical Officer of Health. Dr. Stratton is here to answer any technical or medical questions that may arise, because I'm definitely not qualified to do so. I would like to first start with a brief statement that will outline where we are in our planning, and then I will open the floor to any questions. While it is possible that we could see a case of Ebola in Newfoundland and Labrador, I want the public to understand that the risk of a case of Ebola in Newfoundland and Labrador remains low. The safety of the people of our province and ensuring healthcare workers are prepared, protected, and safe is our top priority. Dr. Stratton and other medical experts in the province have advised me that the Ebola virus itself does not spread easily from person to person. It's not like the flu. Ebola is spread by touching body fluids, for example, blood, vomit, or diarrhea, or other bodily secretions of a person sick with the disease, or from someone who has died from it. Currently, work is ongoing between the Department of Health and Community Services and regional health authorities to strengthen readiness and ensure strong infection control systems and procedures are in place in the event of a potential case of Ebola in our province. Ongoing work includes ensuring proper protocols of infection control are in place, conducting tabletop and mock exercises, ensuring personal protective equipment is ready in hospitals and for those who need it, and that our healthcare workers are properly trained in how to use this equipment and how to respond. Our hospitals have infection control systems and procedures in place, designed to limit the spread of infection, to protect healthcare workers, and to provide the best possible care for the patient. We have established a provincial oversight committee to oversee provincial preparation. This committee is being chaired by my Deputy Minister of Health and Community Services, with representation from the 4 regional health authorities and the various sections of our department. Our work with other jurisdictions in Canada and with the Public Health Agency of Canada is providing our province with up-to-date information on issues that are critical to response. These discussions will make our ability to detect and respond to Ebola even stronger. The Health Sciences Centre in St. John's has been designated as the provincial site for adults and the Janeway for children for suspected and confirmed cases of Ebola. Should a suspected case present at a healthcare facility in the province, the patient would be isolated and then transported to the Health Sciences Centre for further investigation. If a case of Ebola is identified in the province, protocols are in place to isolate, contain, and transport the patient. Community contact tracing would start immediately. Transportation protocols that will involve specialized equipment and training are under development to formalize both road and air transport of patients. This includes appropriate outfitting of select ambulances, providing training, and ensuring appropriate personal protective equipment is in place for all responders. Additionally, to better prepare a provincial response, a simulation exercise is being worked on to test our system. We expect to carry out this simulation the week of October 27th. Work is ongoing to coordinate this exercise, and further details will be provided in the days ahead. In our province, we are recommending the use of enhanced personal protective equipment, specifically impervious gowns and legwear, N95 masks, face visors, and double gloves and hoods. We will continue to work with the Public Health Agency of Canada to monitor any recommended changes to personal protective equipment and to assess scientific evidence, and we will adjust as the recommendations evolve. We are ensuring that regional health authorities have the appropriate equipment and that staff will be trained in its proper use. We have also requested that the health authorities ramp up their training for first responders. This training is already underway. Training is now mandatory for healthcare workers who would be on the front lines. This includes emergency responders, emergency department, ICU, and environmental control staff. I would also like to emphasize that any individuals who are feeling ill and have recently visited the West African countries of Guinea, Liberia, or Sierra Leone, where there are Ebola outbreaks, are advised to call the Newfoundland and Labrador Health Line at 1-888-709-2929 for further instructions. As the situation with Ebola evolves and as new information becomes available, we will continue to assess our state of readiness, and we will make adjustments to planning as necessary and provide updates to the public.